Hi, my name is Edwina.
And I'm Emily, and we're senior dental hygiene students. Our project is on effects of oral health education in patients with special healthcare needs.
After rotations in the Special Healthcare Needs Clinic, we found the need to improve clinical instruments, especially for retraction. In typical offices and clinics, we found metal mouth mirrors and wooden tongue depressors. These traditional instruments can be sharp for the patient and become uncomfortable through the course of the appointments. With the use of a universal soft tissue retractor, we found increased comfort and visibility of the oral cavity. We met with our mentor, Dr. Alan Wong, and decided to focus our research on plaque control using universal retractors. Our specific project focuses on creating an informational brochure for caretakers to use one of the universal retractors on the market today.
In our research, we included three main ways we can improve the oral health care for patients with special healthcare needs, which are management techniques, desensitization, and lastly, oral home care education. One of the biggest barriers to care in providing oral health care is the fear of dentists from the public. Patients with special healthcare needs may have sensory triggers, anatomical abnormalities, and face other barriers when seeking dental care. When dental needs are unmet, the periodontal condition worsen and could lead to unwanted tooth decay. Early intervention and maintenance care is important to ensure the patient's oral health is in good condition. Interventions such as a sensory desensitization, caregiver education, removing the barrier to seek care, and utilization of alternative tools such as a universal retractor will help increase patient compliance.
This review aims to evaluate the challenges and effectiveness of oral home care education on plaque control in patients with special healthcare needs by way of literature review. Oral health education with alternative delivery methods such as a brochure and tell show do will increase patient and caregivers' understanding on how to perform proper oral hygiene outside of a dental setting.
When working with individuals with special healthcare needs, clinicians should be conscious of the tone, sensory triggers, and working closely with the caregiver to formulate a comprehensive treatment plan that is best fitted for the patient. Scheduling short multiple morning appointments have been shown to have greater patient compliance. Using alternative oral hygiene aids such as a soft tissue retractor can allow the care provider to have more visibility, easier retraction, sensory desensitization, and increase in patient compliance. When compliance increases, then oral hygiene routines should be enforced to help manage and control periodontal health status, along with plaque control. We created a figure on steps of desensitization for providers to use as a reference, and another figure explaining the advantages of a soft tissue retractor in both a dental and non-dental setting. Further research is needed to evaluate the correlation between oral health education and plaque control.
Using the study, we created a brochure for the soft tissue retractor to be used for caretakers and for caretakers to use with their patients. Compared to traditional dental instruments and oral hygiene aids, the silicone material does not cause sensory sensitivity. Many instruments patients are familiar with can include metal hand mirrors and wooden tongue depressors. The soft tissue retractor increases individual compliance during toothbrushing and flossing with floss holders or floss picks. This allows for assisted care to be tolerable for the patient, increases visibility, and access to the oral cavity. It can bend easily for adaptation to the working area, increase better control using the grip with the thick handle, and the rubber tip that is almost spoon-like. The retractor is easy to use, clean, and store. To bend the retractor, the user can run it under warm water. After, the product can be cleaned with water and stored in a dry area. We've included 2 QR codes that care providers and readers can scan. The first is a video we created to show how to use the retractor as a patient and the care provider. The second scan provides access to our research paper. As of currently, the ComfortSoft is the only one of its kind and the only sample soft tissue retractor we own. We are not sponsored by the company, and this research was inspired by the product. Lastly, we would like to thank our mentor, Dr. Alan Wong, and our sponsors.
We look forward to meeting everyone at the spring scientific session.